Have you noticed your urine suddenly looking unusually foamy? Don't panic, but don't automatically ignore it either. Sometimes bubbles are harmless, but if the foam keeps coming back, it could be a clue worth checking. Persistent or frequent foamy urine can sometimes be associated with protein in the urine, while occasional bubbles can simply result from the force of urine hitting the toilet water. One possible reason for persistent foam is protein in the urine. Normally, your kidneys act like highly selective filters, keeping important proteins such as albumin in your bloodstream. But when those filters become damaged, protein can sometimes leak into the urine. That condition is called albuminuria or proteinuria. It can be an early sign of kidney disease, but foamy urine by itself cannot diagnose a kidney problem. If the foam keeps appearing, especially along with swelling around your feet, ankles, or eyes, it may be worth asking a healthcare professional about a urine test. Not every episode of foamy urine means your kidneys are in trouble. When you're dehydrated, your urine can become more concentrated, and you may notice more bubbles or foam. This can be temporary and may improve once you're adequately hydrated. But if the foam keeps returning despite normal hydration, it's better not to assume it's simply dehydration. A urine test can help identify whether protein is present. But there's another reason persistent foam deserves attention. Sometimes foamy or bubbly urine can happen simply because urine hits the toilet water with force. Cleaning products in the toilet can also create bubbles that look like foam. So seeing bubbles once or twice doesn't automatically mean something is wrong with your kidneys. The important difference is what happens over time. If the bubbles disappear quickly and don't keep returning, there may be no reason to assume kidney disease. But persistent, unusually foamy urine deserves more attention, especially when other symptoms are present. And this is where testing becomes more useful than guessing. If foamy urine keeps coming back, a healthcare professional can check your urine for albumin or other proteins. A urine test can provide information that the appearance of your urine simply cannot. If you have diabetes, persistent foamy urine is worth discussing with your healthcare professional. Over time, high blood glucose can damage the tiny blood vessels that make up the kidney's filtering system. This can allow albumin, an important blood protein, to leak into the urine. This doesn't mean that every person with diabetes will develop kidney disease. Risk depends on factors such as blood glucose control, blood pressure, and other health conditions. That's why regular kidney screening can be important for people living with diabetes. If you have diabetes and repeatedly notice foamy urine, don't try to diagnose the cause from appearance alone. A healthcare professional may check your urine albumin to creatinine ratio, along with blood tests such as creatinine and eGFR to assess kidney health. And diabetes isn't the only condition that can make this clue worth investigating. High blood pressure is another important kidney health factor. Over time, consistently high blood pressure can damage the small blood vessels inside the kidneys. When those filters become damaged, albumin and other proteins may leak into the urine. The relationship can work in both directions. High blood pressure can contribute to kidney damage, while kidney disease can also make blood pressure more difficult to control. But foamy urine alone cannot tell you which problem, if any, is present. If you have repeatedly high blood pressure and notice persistent foamy urine, ask your healthcare professional whether kidney screening is appropriate. Blood pressure monitoring, urine albumin testing, creatinine, and eGFR can provide much more useful information than urine appearance alone. But what if your urine looks foamy, along with another very noticeable change in your body? Now look beyond the toilet. If foamy urine keeps returning and you also notice swelling around your feet, ankles, or even around your eyes, that's a combination worth discussing with a healthcare professional. When significant amounts of albumin are lost through the urine, the body's fluid balance can change and swelling may occur. But swelling has many possible causes, including heart, liver, vein, medication, and other health problems. So this symptom combination cannot diagnose kidney disease by itself. If persistent foamy urine is accompanied by new or worsening swelling, don't rely on symptoms alone. A healthcare professional may use urine albumin testing and blood tests such as creatinine and eGFR to investigate what's happening. And there's one more important clue you should pay attention to, especially if these changes keep coming back. If foamy urine keeps coming back, the most important step is not trying to diagnose yourself from what you see in the toilet. The better question is, could there be protein in the urine, and should it be tested? A urine albumin to creatinine ratio, often called UACR, can help healthcare professionals check whether albumin is leaking into your urine. If the result is abnormal, it may need to be repeated or investigated further, because temporary changes can happen for several reasons. So if the foam is persistent, especially when it comes with swelling, high blood pressure, diabetes, or other kidney-related concerns, talk with a qualified healthcare professional. Testing can provide information that symptoms alone cannot. So, should you be worried if you see foam in your urine? Not necessarily, but knowing what to watch for can help you decide when it's worth getting checked. So, if you notice foam in your urine, should you panic? No. Occasional bubbles can happen for completely harmless reasons. But if the foam keeps returning, becomes unusually persistent, or appears alongside swelling, diabetes, high blood pressure, or other health concerns, it deserves attention. Remember, the appearance of your urine cannot tell you exactly what's happening inside your kidneys. A urine test, particularly one that checks for albumin, can provide much more useful information. Your healthcare professional can decide which tests are appropriate based on your symptoms and risk factors. And if you ever notice blood in your urine, very little urine, significant swelling, severe shortness of breath, chest pain, or a sudden major change in your health, don't wait for an online video to provide an answer. Seek appropriate medical care. If this video helped you understand what foamy urine can mean, give it a like and subscribe to VitalBites. This is week 1, day 4 of our 90-day healthy aging series. Tomorrow, we'll look at another kidney warning sign that many people notice but don't always understand. This video is for educational purposes only and is not intended to diagnose or treat any medical condition. If you have persistent symptoms or concerns about your kidney health, please speak with a qualified healthcare professional.